My name is Daniel Russ Blankenship. I am an otolaryngologist or an ear, nose, and throat specialist with Hughston Medical Group here in Columbus. I've been in practice for 15 years now. To me, what appealed to me about being an ear, nose, and throat specialist was the breadth of our specialty in terms of the ages that we take care of. We take care of anywhere from newborns all the way up to 100-year-olds. We take care of men, we take care of women. Specialty is unique in a way in that we do a lot of both surgical and non-surgical management. And so the fact that I could do all of that in one specialty really is what appealed to me. The most gratifying part of my job is when you know you've helped a patient. And of course, that's our goal. You know, every time we walk into an exam room, walk into the operating room, we're there to help. But when we know we've made a difference, and patients will even go out of their way to say thank you, and you've made a difference in my life, that's very gratifying. I think in terms of the most dramatic change I've seen in my career, 15 years and 20 years going back to the beginning of residency, again, social media and the impact that that's had on patient attitudes and behaviors, and how they really do spend a lot more time not only researching their disease, but also you as the physician before coming in to see you. So, I mean, the fact that now patients come in with so much more knowledge is something that has changed dramatically, and you have to be prepared for that, and it's only fair. I mean, I would do the same, if I were the patient on the other end. In fact, I have done the same. And so I think to me that's the thing that's made the biggest difference in our specialty over that time course, is just the advent of social media and all that means about the patient-physician relationship. In terms of advice, that I would give as an otolaryngologist specifically, I think don't ignore, small symptoms. I think that a lot of the things that we see and deal with that can be scary things start off as small symptoms that most of us experience on a day-to-day basis. And it's okay to experience occasional symptoms like hoarseness or sore throat, of course, maybe cough. But those symptoms should not become chronic. They shouldn't go on for 4 weeks or more without at least seeking the care of a medical professional to say, hey, why is this not getting better? So that's the main thing, is really just kind of listening to your body, paying attention to the small clues, because they can be big things if you ignore them. Goals for my personal professional life, I think, again, hard to settle on just one. To me, I am just as much proud of my role in my family as a father and as a husband and as a son, and to say that I have any specific professional goals. Well, my goal every day is the same as my goal for my entire career, which is to show up and to work hard for my patients and to help cure whatever ailment they may come in with. So if I can get to the end of my career and feel satisfied that I've done my best in that respect, then I've met my career goal. To say that there's one specific goal, I wouldn't say that necessarily. I think just to know that looking back, I've done my best for every single patient every day. In terms of personal goals, it's very, very similar. Just being the best father I can, being there, for my wife and for my children and my parents too is important. And so having a good work-life balance, I think, is something I want to be able to look back at the end of my career and say I was able to accomplish that as well. For me personally, Hughston Medical Group has helped me regain a sense of control over my practice. And to come into the Hughston model, I feel like it's not so much a employee-employer relationship as it is a team. Definitely helped us more with being in terms of online presence and social media presence and marketing. That has really been a big step forward as well for my practice, and I've certainly appreciated that. Their expertise in that regard, helping me reach more patients, has been just a tremendous help.